States are contemplating expanding Medicaid per the Affordable Care Act. It's a tough decision with many considerations. One way the Affordable Care Act sought to expand health insurance coverage was by mandating that states expand Medicaid to cover more people. The federal government promised to cover 100% of the cost through 2016, declining to 90% over the long term. States were told if they did not expand Medicaid, they could lose their current federal Medicaid funding. In 2012, the Supreme Court said that the power to cut off current federal Medicaid funding from states that didn't comply was unconstitutional, effectively taking away the stick but leaving a huge pile of carrots when it comes to funding. Now that expansion is optional, states are considering whether or not to expand Medicaid to cover those up to 138% of the poverty line, which for a family of 4 is a little more than $32,000 a year in income. Medicaid already accounts for a big percentage of state budget expenditures, nearly 24%. Even without expansion, states' costs are projected to increase dramatically, more than 150% over the next decade, as Medicaid caseloads and per-enrollee costs increase, and as temporary federal stimulus dollars that propped up Medicaid expire. Proponents of Medicaid expansion say that the deal is too good to refuse, since the federal government is going to pick up most of the tab. Some even argue that Medicaid expansion will save the states money. However, there is no guarantee that the federal government will maintain the full amount of financing going forward. Current policy projects federal spending on Medicaid, CHIP, and the ACA's health exchanges to double as a share of our economy. After that, it continues to grow on an unsustainable path. And there is no plausible way to return federal spending to sustainable norms without reducing federal spending on Medicaid. Unless states are allowed to restructure their own Medicaid programs, the inevitable future reductions in the flow of federal dollars would require states to carry more of the burden of funding the program. The dollars will either come from higher state taxes or from reductions in other spending. In other words, as Medicaid grows, there will be less money for state projects like roads, schools, and services like police and teachers. There's another complication as a result of the Supreme Court's decision. The Medicaid expansion and the newly created healthcare exchanges no longer work together as originally designed. As originally designed, the ACA establishes health exchanges with federal subsidies available to people who are above the poverty line. People can only take advantage of these subsidies, however, if they're not eligible for Medicaid. This creates a big incentive for states to not give Medicaid coverage to childless adults above the poverty line. If these individuals are covered under the exchanges instead, the federal government will pay their full subsidy. It is also likely that health exchanges will provide participants with more generous health insurance coverage and better access to medical care than Medicaid. And what should states do about covering those with incomes below the federal poverty level? Recently, the federal government said that if states cover only this population, the federal government won't give the states the total support promised under the ACA. So states can only cover this population by putting in more of their own money. That's a big problem for states whose budgets are already strained. The ultimate answer lies in structural reforms to Medicaid that empower states to manage the programs based on their particular state's needs. They can improve the delivery of care to those who need it the most, while also reducing the growth of total Medicaid spending. Until that day comes, many states will rightly be reluctant to make any decision as long as the federal fiscal problem remains unsolved.